Unit 6. Individual Differences. Presentation 9. Psychological Therapies. Cognitive Behavioural Therapy.
In this presentation, we'll be looking at a form of psychological therapy based on the cognitive and behavioural approaches to abnormality. Cognitive behavioural therapy. Therapies derived from these approaches are based on the idea that many problems relating to abnormal behaviour are the results of irrational thinking.
The longer these irrational ways of thinking are allowed to continue, the more likely they are to become lifelong habits. However, once they are identified and challenged during therapy, their power is diminished. Cognitive behavioural therapies, such as Albert Ellis's rational emotive behavioural therapy, help the individual to change this self-destructive way of thinking and so become happier and less anxious about life.
Before we examine how this type of therapy works in practice, let's look at the background to irrational emotive behavioural therapy, abbreviated to REBT. Ellis believed that people frequently develop abnormal behaviours because of their faulty beliefs about the world around them. For example, a person may believe that they have to always have the approval of others. These irrational beliefs may lead to self-defeating thoughts, such as a feeling of worthlessness if they meet someone who is critical of them.
At the core of REBT is the ABC model. The A in this model stands for the activating event, an example of which might be the teenage boy who has just been dumped by his girlfriend. This event leads to the belief concerning why this might have happened. This might be irrational. For example, she dumped me because I'm a loser. Or rational, we're just incompatible.
Ellis believed that it was the belief rather than the activating event that resulted in an emotional consequence. If the belief was rational, this might result in feelings of temporary sadness. But if the belief was irrational, then the consequence is likely to be depression or anxiety about future relationships. So, as I'm sure you'll have worked out, the C in the ABC model stands for consequence.
So, how does REBT work in practice? Having identified the patient's irrational thought processes, the therapist will try to change these self-defeating beliefs and so help the person become happier and less anxious. During the therapy, the patient is encouraged to dispute their beliefs and replace them with healthier, more rational beliefs.
To achieve this, the therapist makes use of different types of disputing, where they challenge the basis for the patient's beliefs. They can, for example, use logical disputing, where they ask the patient whether thinking in that way makes any sense. With logical disputing, the therapist is essentially showing that the self-defeating beliefs do not follow logically from the information available. For example, our jilted lover may be encouraged to acknowledge that nothing suggests that they were dumped because they were a complete loser.
Another approach involves empirical disputing, where the patient is shown that their belief is actually inconsistent with reality. For example, our dumped teenager could be shown that he has lots of friends, none of whom appear to regard him as a loser, that he has actually ended all of his former relationships, or perhaps that his former girlfriend is really quite different to him, and therefore, quite possibly, they were incompatible.
A third form of disputing used in REBT is referred to as pragmatic disputing. The therapist emphasises how self-defeating beliefs are not at all useful for the patient and don't help them to deal with the problem concerned.
So, for our jilted teenager example, the therapist could point out to him that believing he's a loser won't do him any good in the long term, and it is much better to believe he and his girlfriend broke up because of incompatibility. Could this type of treatment be useful for students who suffer from exam nerves?
Indeed it could. Let's imagine a scenario where a student gets so anxious about an upcoming exam that they have virtually written off their chances before they even get to the exam hall. We could attempt to change their self-defeating thoughts into more positive and constructive ones. For example, students frequently say that they're no good at exams, a self-defeating belief if ever I heard one. By challenging this belief, for example by pointing out that they must have done reasonably well in their GCSE exams to be taking A-levels, we can make use of the technique of empirical disputing. We might also point out to them that thinking in this way isn't likely to help them because it makes them less likely to do anything about their poor exam performance. For example, finding out how to revise properly. This would be an example of pragmatic disputing.
Now we can switch our attention to an evaluation of rational emotive behaviour therapy. We can start by examining its appropriateness in the treatment of abnormality. A particular strength of this form of therapy is that its usefulness is not limited to people suffering from diagnosable mental disorders such as depression or phobic disorders. It's also appropriate to subclinical populations as well. This means that it can be used for individuals suffering from stage fright or examination anxiety rather than being restricted to people with diagnosable mental disorders.
A second strength of this type of therapy is its effectiveness. Or, to put it another way, it works. REBT is effective because it works in the treatment of many different types of disorder, including obsessive-compulsive disorder and agoraphobia, the intense fear of being in public places where escape might be difficult. A 1993 meta-analysis of 28 studies by Gemma Engels and colleagues found that this form of therapy was more effective in the treatment of anxiety disorders than systematic desensitization or a combination of other therapies.
A limitation of REBT is that it fails to address the problem of irrational environments. By emphasising the importance of irrational thinking alone, it ignores the fact that, for some people at least, it is their environment that is irrational. Some people do have bullying partners or overly critical bosses. These environments persist beyond the therapist's office and continue to produce and reinforce the individual's self-defeating beliefs and their inappropriate behaviours.
Could you just explain that one again?
An assumption of this type of therapy is that the problem lies in the individual's way of thinking about their world. For example, they may think that people are hostile and always picking on them, when this simply isn't the case. The aim of therapy is then to change that way of thinking into something more healthy and realistic. But let's suppose that their thinking is an actual reflection of what goes on in their world, and that, for example, their boss or partner really is hostile toward them. Changing the way they think about events will be pretty pointless because the real problem actually lies elsewhere.
A final limitation for this therapy is that it may not be suitable for everybody. As is the case with all psychological therapies, REBT doesn't always work, and it is not always what people want. Some people don't get on well with the direct sort of challenging advice offered by cognitive behavioural therapists and so reject the therapeutic support. Albert Ellis believed that some people don't get better after REBT because, despite claims to the contrary, they were failing to put their revised beliefs into action.
What can we conclude? Unlike most other forms of therapy, where the patient plays a rather passive role in their recovery, cognitive behavioural therapies demand a much more active role for the patient. Patients must put into practice what they have learned during therapy, otherwise recovery will be a distant dream. This may well be the very reason why, for some people, it fails to make an impact, because they don't do what they are asked to do in order to get better. The effectiveness of cognitive behavioural therapy, therefore, is best summed up in the words of the old adage: you can lead a horse to water, but you can't make it drink.